if you want me to use your page, no, your, sorry, what's that? If you want me, guys, if you want me to use your date as an example, you can go to the YouTube page. Okay. The YouTube is live. So I need somebody to come over to tell me if the volume, sound, everything is okay. And now after the teaching, I'm going to take, maybe we'll be taking the testimonies, and then we'll switch back to questions and answers. So come over to the YouTube page. Why am I not seeing? I'm not seeing anything on the comment section on the YouTube. I just want to know some. Okay, somebody's there. All right. Guys, if you are new already, all this teaching is already on our YouTube page, okay? But for the benefit of those people that are just joining us and they just want to hear me talk in real time, that's why I'm doing this. Okay, I have to do the mirror thing here. So that's why I'm doing this, and we'll start. Okay. So if you're a woman, you've been trying for many years, or you're trying for a baby boy, okay, pay attention. It doesn't matter how long you've been trying for baby. 1 month, 2 months, 3 months, 4 months, 5 months, 1 year, 5 years, 10 years, 18 years, 19 years, it doesn't matter. Just pay attention. Knowledge, they say, is power. It's possible, maybe apart from medical reasons, it might be that you're just doing something solely to something like minor mistake, things that you would usually not even see as mistakes. It might be what you've been doing wrong. Just try this, my method. For you to come to my page, I understand that you've already done everything. You've already been everywhere. You have already taken all the concussions there are. You have already taken all sorts of medication and treatments. Okay? Try this one and let's see. So I'm just writing some of the items that you'll be needing. So the first one, now, welcome everybody, everyone that has come here today. I pray that you get what you're looking for. If you want baby boy, you get. If you want twins, just listen attentively, you will get. If you want triplets from your mouth to the ears of God, you will get. And if you say quadruplets, all well and good, it's yours. But listen, okay? Listen. So if you're a woman that have been trying for baby for many years, or you are trying specifically for a baby boy, listen attentively. So the first thing you will be needing in order for you to be trying for pregnancy, especially if you've been trying for long or you're trying for a baby boy, you need ovulation testers. And some people will argue, oh, I don't think ovulation tester is important because anytime I'm on my ovulation, I'm already feeling the cramp. Always know I feel a certain way. Guys, that's not correct. In order for you to know specifically that you are ovulating, you actually, at the comfort of your home, I'm not talking about all those follicular tracking people go and do, just wasting their precious time and money, when you can strategically stay at the comfort of your home and monitor your ovulation. Guys, you need ovulation tester. Which type of ovulation tester will I recommend? I'm recommending you get the clear blue ovulation tester. Again, it's not my product. I don't own it and I'm not their brand ambassador. However, over the years, that's what I've been using, even when they've not made their latest clear blue. I was using their old type before I wrote them, but I didn't get any reply. But to my greatest surprise, they came up with something similar to what I had written about. So if it was my own idea they used, I don't have a clue. If they were already in the middle of developing another one as at then, I have no clue. But I'm talking about over 17 years ago. 18, 17 years ago. Now, Clear Blue Ovulation Tester is owned by Procter and Gamble. Procter and Gamble, I don't have any affiliations with them, okay? So that you won't think, oh, this is an advert for them. If they pay me for advert, fine. But whether they pay me or not, that's the one I'm familiar with, and that is what I know. So, and I don't like a situation whereby I will be recommending something that I've never used myself to anyone. I won't do that. I'm not that desperate. I'm a very contented person. Okay? So please, if you're trying for many years or you're trying for baby boy, go and get yourself Clear Blue ovulation testers. Where can you find Clear Blue ovulation testers? You can find them in leading pharmaceutical stores all over Europe and America. Okay? Again, where can you find them? Maybe if you're in Nigeria, you can find them in, I think, Med Plus or H Medics or whatever. Just big pharmacies will have it. But if you're not sure of the type I'm talking about, because Clear Blue themselves, they made many other types of ovulation tester. But this particular one I want you to get, I already did a video and I posted it on my TikTok page. So if you go to my TikTok page, the only pinned posts I have on my TikTok page is there. The only pinned post on my TikTok page, okay, is the ovulation tester, the particular one I want you to get. However, if you're confused or maybe you're not sure as to whether you are actually going to purchase the right one, then you can go to my TikTok page. Underneath my profile picture, I added a link. You can click on the link tree. There's link tree underneath my TikTok profile picture, okay? You will see link tree. Click on it. When it opens, you will see Amazon. Click on the Amazon. You can order from anywhere in the world. And another thing is that I will advise, if you want to get the 30 sticks. Why are you getting the 30 sticks? Peradventure, God forbid, you don't get pregnant the first trial, the first month. at least you will have more than enough sticks to take you through the second month. It's very important. The 30 sticks, I think, is more economical. So get the 30 sticks just so that you have more than enough to be testing. If you don't get pregnant the first month, at least you have more than enough to test the second month. Now, some people, and then while you are there on my Amazon storefront, get pregnancy tester. Because why? Because you will be testing for pregnancy at least 2 weeks after your ovulation. Again, when I say 2 weeks, I mean 14 days. But still, sometimes you just have to give yourself extra 5 days on top, because if the hormone is not high enough, you might not see the positive result on time, but you will definitely see it eventually if you're pregnant, if you get pregnant. Okay? Now, some people will be like, oh, Edith, I don't think I need the ovulation tester, because anytime I'm ovulating, I always see cervical mucus. So that's how I know I'm ovulating. Sorry. Seeing cervical mucus does not mean that you are ovulating. It's not an evidence of ovulation. Cervical mucus can come during the month at any time at all. As the name implies, cervical mucus, cervix, cervical, cervix, it's from your cervix. So that does not mean whether you are ovulating or not. Sometimes cervical mucus can be extremely present and overflowing because your body is very high in alkaline at that moment. So the truth is that whether or not you see cervical mucus, you will still get pregnant. Okay, people on YouTube, I hope you're getting that. Don't let anybody bully you or scare you into believing that you have a problem for not seeing cervical mucus. Cervical mucus is completely immaterial if you're trying for pregnancy. Okay? Again, cervical mucus is up high in your cervix. It's not, but if it's overflowing, few people will see it in their panties, but we don't care. If you want to know whether or not you're ovulating, get yourself ovulation tester and test. Of course, you just don't test randomly. There are days that you are required to test. And I'll be discussing about that later on. Okay? Now, who are those people that say, oh, I have both cervical mucus and the cramp? That's how I know I'm sorry. If you won't be using ovulation tester, there's no point trying to sit down here to listen to me to justify your action. Please, you will need the ovulation tester just so that in case, if anything happens, I will be sure that you actually met your husband or your partner during the peak of your ovulation. Okay? Please, it's not an issue of, I know times are hard. That product doesn't belong to me, but in order to cut your waiting period short, the best thing you can do is just go ahead, get yourself ovulation tester so that you don't waste much time, trying. When you are trying without ovulation tester, you are more or less doing guesswork. You don't want to be doing all those guessing games here and there. But don't worry, just trust me on this. Get yourself ovulation tester. It will make the whole journey easier. At least it will help you to understand your body. Okay? Now, the next on the list is folic acid. Folic acid. Why folic acid? It's very, very important for women trying for baby or women that are pregnant to be taking folic acid, especially before getting pregnant, 3-4 months before getting pregnant, up till at least minimum of the first trimester. You need to be using your ovulation tester up until you're about 4 months gone. You can even use it throughout your entire pregnancy. Why is folic acid good? Folic acid is the single most important medication you will require during the course of your pregnancy, before and during the course of your pregnancy. Why? Because it helps to prevent many kinds of birth defects. And to a certain degree, it will help prevent miscarriages that happen in the early trimester. That is when you adhere to the do's and don'ts that I will be mentioning much later. Now, we spoke about folic acid helping to prevent many kind of birth defects. Do you know the kind of birth defect I'm talking about? I'm talking about hydrocephalus. I'm talking about spinal bifida. If you don't know what spinal bifida is when somebody gives birth to a baby with an abnormally big head full of fluid. But if you're taking folic acid, that won't even happen. Never, never. It cannot happen. It cannot happen. Okay? Another thing is cleft palate. If you're not taking folic acid, you have, I don't know, some of you might have seen children born with cleft palate issue where top of their nose down to their upper lip cleft will be torn open. And as the child grows, you'll be seeing their teeth through the nose. If you are taking folic acid during pregnancy, you will never, ever have such, well, your baby will never have such defects. You will never be able to face such terrible problem. Guys, it's not even a joke. If you notice, you might have seen someone on the way with, like a bit of stitch. They have like, you have to see the mark. But for like white skinned, it heals well, but you will still see it there. But what am I trying? You don't want to put your baby through all those kind of unnecessary hassle. So it's very important. Make sure you are taking the only medication actually you are allowed during the course of your pregnancy is folic acid, before and during the course of your pregnancy. Apart from the next one, which I will be discussing later on. Now, folic acid. What kind of folic acid do you want? You just want folate, just folic acid. You don't want folic acid with vitamin D. You don't want folic acid with B12. No. All you just want, go to the pharmacy, any pharmacy. You don't need prescription for it. Okay? Go to any reputable pharmacy. If you're in Africa, make sure it's a reputable pharmacy. Okay? Because in Africa, there is high chances that maybe you'll be coming across fake medication. So if you're buying, make sure you go to a very, very good pharmacy, not a roadside chemist. Okay? Now, get folic acid, folate, just folate, that is just 400 micrograms. You don't need 5 milligrams. 5 milligrams will usually be prescription folic acid. All you need is 400 micrograms of folic acid. Why? So that even if you're not folate deficient or you are not deficient in folate, 400 will not is just a therapeutic dose, not to spike things up, and is a therapeutic dose to ensure that you don't fall short. So it will just keep you on that therapeutic level. So you need your folic acid. Make sure, even if you have not gotten pregnant now, that you are just still trying, make sure you are taking folic acid, no matter what. Now, I understand that some doctors, mostly in Africa, will be like, oh, don't take folic acid when you have fibroids. Excuse me, if you get pregnant with fibroids and you're not taking folic acid, would you rather have a deformed baby? Would you rather? It's important to weigh the outcome, okay? It's important for you to ensure that that your decision, okay, outweigh. If the consequences outweighs the benefits, you better run. You better run. If you get pregnant with fibroids, and because you listen to those people that don't know 1 + 1, you did not take folic acid, if your baby comes out with any form of abnormality or deformity, just know that you should have yourself to blame. Okay, guys, Make sure you are using your folic acid to avoid any story that touches the heart. Folic acid will help prevent abnormalities like a spinal bifida, cleft palate. It will help the woman as well not to miscarry easily. Easily, of course, if you'll be adhering to the do's and don'ts that I'll be mentioning later on. Now, what about those people that are not married yet and they are not pregnant yet or they are not trying yet? Folic acid is actually very, very important for women maybe in their late 20s, early 30s to late 30s, okay, who are not married yet, but they know that one day they will get married and they will want babies. It's important for you to be taking folic acid because it will help ensure that your fallopian tubes stay clean, stay unblocked. There won't be any blockage. Any debris or whatever that is flowing in those tubes, folic acid will ensure it keep them clean, cleansed, constantly. Clean, cleansed. While you are waiting for Mr. Right, make sure you are taking folic acid. Again, I'm not talking about those people that already have blocked fallopian tubes. If your fallopian tube is already blocked, you will need to go to your doctor and you will make a referral to maybe a specialist that will discuss what treatment options are there for you. Okay, please don't do anything drastic or don't just do anything out of the ordinary. Don't be desperate to just do also take advice from anywhere, going to drink all sort of concoction in order to unblock blocked fallopian tubes. Don't do that. Please, my young ladies, okay, that are not married yet, there's no point investing on all sort of supplements. You don't need all those supplements. All you need is folic acid. Again, if you're not like 40 years and over, you shouldn't have any business with all any form of supplement. Even if you are over 40 years, if you're eating very well, most of those supplements you're taking, you will not need them. Okay? Now, again, with folic acid, you don't need prescription. Go to any pharmacy. If you're in Europe, America, any pharmacy, you will get it. But if you are in Nigeria or other parts of Africa, make sure you go to a well-known, a reliable, okay, pharmacy. Please don't go to roadside pharmacy to avoid being sold any fake medication. Folic acid is very cheap. You don't need much, and you don't need to take more than 400 micrograms, very tiny tablets per day. It will do you and your baby a lot of good. Okay? Now, or if you want, because it's not a prescription medication, you can go to my TikTok page. Underneath my profile picture, you will see Linktree there. Click on the Linktree. You will see Amazon. Click on Amazon. Get yourself folate. Just folic acid. Folic acid is the trade name. The generic name will be folate. All you need is folate, not folic acid with vitamin D or folic acid with B12. We don't want that. Okay? Now, the next on the list is iron medication. If you look very well, you will notice that I've written in red, if indicated by your doctor. Why did I write that? Because not everybody will require iron medication. You will only require iron medication if you're iron deficient, your iron is low, or you are anemic. And how will you know that your iron is low? Even though sometimes it can be symptomatic. Symptoms you can get from low iron could be dizziness, it could be fatigue, it could be nausea. You'll be feeling nauseous, okay? Or when you start trying to get up, you just be like see yourself a bit dizzy or trying to like nearly collapsing. You need to go to your doctor. When your doctor orders FBC, that's full blood count, from the results, he will be able to tell you if your iron is within threshold or if you're terribly deficient, maybe anemic or just low, a bit deficient, okay? then he will recommend you take iron. Again, just like folic acid for iron medication, most iron medication, you won't need any prescription. All you need to go do is to go to a reputable pharmacy, okay, and get yourself iron medication there. You don't need anything. Even though there are some iron medication that you will need prescription for, but most of the time people don't you don't need prescription. Okay, the prescription iron medication are different. You don't need it. All you need to do is go to a reliable pharmacy and get yourself iron medication. Okay, now the last on this board is avocado. Wow, you'll be wondering, how did avocado get to what we are learning about? But the truth is that avocado is actually gold given to all humankind by God, whether rich, average, or poor. I think everybody have access to avocado. Everyone can afford avocado. Why is avocado very good? Why do I call it gold? Most of the fertility medication you will be taking, some of their ingredients you will find in avocado. Why do we recommend avocado? Especially if you have been trying for many years or if you're trying specifically for baby boy. Please, if you're looking for baby girl, just avoid avocado for now. Okay? Now, why is avocado very good? Avocado is high in omega-3 fatty acid. Avocado is very high in vitamin E. Avocado is extremely high in alkaline. Before I go to alkaline, avocado contains folates, even though not very high, but at least we are taking our folic acid. If you look at what I've listed, you will find out that most of the people battling with fertility issues, doctors will be recommending they take all these kind of supplements. However, a more natural way to go is to eat avocado. Why? Some of those supplements you buy, okay, some of them, what is some of them? Most of them are made with other things, fillers and all what, I don't know, all what not there. However, for somebody trying for a baby, because getting pregnant is supposed to be a natural process. That is how God designed conception originally. But these days, people think until they take heaven and earth, all sort of concoction, all sort of medication, that's the only time they will get pregnant. And oftentimes people come to this page and ask me, tell me, recommend which medicine, what should I take? I want to get pregnant. No. Just slow down. If you listen to me, just do the right thing. Avocado contains many other nutrients as well. But the only one I'm just mentioning for the purpose of what we are teaching and learning here is this ones. Do you know avocado still contains vitamin C? Avocado is very high in antioxidants. Avocado contains so many nutrients and minerals that I've not listed, but these are just the few I want you to see. But if you want to learn more about avocado, you can go Google it, or people that like asking AI or ChatGPT, you can go ahead and do that, okay? Avocado have been there from time immemorial before we were born, even. So, and is natural. It's just an everyday fruit, and you will find it in every grocery store in America, Europe, Asia, every. But just in Nigeria, they don't, our grocery is different. But you will find it in every market. Every market you go to in Nigeria, you will find it. Or in Africa, except maybe it's not in season where you are. But if you live in Europe and America, it's not about season because they import from all over the world. So you always have avocado there. Now, if you look very clearly, avocado is extremely high in alkaline. Alkaline is extremely good. Why? Why is alkaline good? And this avocado is extremely high in alkaline. Why is alkaline good? Sickness doesn't like alkaline environments. When your body is always like high in alkaline, you won't be getting sick easily. When your body is always high in alkaline, you see all those things growth like tumors, you won't be getting them easily. When your body is always high in alkaline, cancer, they don't like alkaline environments. And that is just the truth. What else doesn't like alkaline environment? But we're not talking about cancer today, Bob. It's just good for you to know that. What else? The reason why you see people coming to this page getting pregnant despite diagnosis is once your body is high in alkaline, even cysts doesn't like alkaline environment, meaning that even with your ovarian cyst, you will still get pregnant. After all, we've gotten few cases of a girl. One girl had 2 cysts, the other one had 1, and they are all pregnant. By now, they must be around 3 or going close to 4 months now with no issues. So, again, what hurts alkaline? Hormonal imbalance. This alkaline, avocado, if you're eating a lot of avocado, despite your hormonal imbalance, you should be able to get pregnant with no much issue. Even if you have PCOS, you're taking a lot of avocado, your body is high in alkaline, you shouldn't have problem getting pregnant. People with hypolactin as well. Like on the book, we have a lot of people that have testified with all manner of diagnosis, but they still got pregnant. Do you know why? Because they're abiding by the do's and the don'ts, okay? They're adhering to them. And they are eating a lot of avocado, okay? Now, what else like avocado? Do you know what else like avocado? Because avocado is high in alkaline, the XY chromosome likes alkaline environment. What does that mean? If your body is very high in alkaline, you have more than 99% chances of having baby boy. XY chromosome is the chromosome responsible for a male child. However, there is the other chromosome, which is the XX chromosome. The XX chromosome doesn't like alkaline environment at all. So therefore, if you're trying for a baby boy, don't go near avocado. Baby girl. If you're trying for a baby girl, don't go near avocado. If you're trying for a baby boy, avocado should be your best friend. If you have ovarian cysts, avocado should be your best friend. If you have PCOS, avocado should be your best friend. If you have hormonal imbalance, avocado should be your best friend. If you have cysts, avocado should be your best friend, okay? Even endometriosis or all those other illnesses. And if you are eating enough avocado, I think during your pregnancy, you will stay healthy most of the time. Okay, it will keep you healthy most of the time. I hope I'm clear about that. Now, guys, if you look up, I don't think you would have heard me mention any other thing. These are the things you need. I don't think you heard me mention any supplements, any medication. Okay, that is irrelevant, immaterial. You don't need them. Okay, therefore, this Edith's method of natural gender selection is strongly against the indiscriminate abuse and use of medications and concoction. Why? Because God originally designed conception to be a natural occurrence, to be something that you won't need a lot of effort in order to get pregnant. However, I don't know how our world has come to this. People now believe that they need to be on all form of supplement or on all form of concoction in order to get pregnant. That is just not the case, unfortunately, for those people that are expecting me to mention their favorite drugs. No. Can I kindly ask, because this is the Edith's natural method of gender selection, okay? Can I kindly ask that, please, if you have any supplements within your reach, Omega-3, get this bag, throw it in there. Vitamin E, get this bag, throw it in there. If you have any medication, vitamin C, throw it in there. If you have magnesium, throw it in here. If you have 7 C's, throw it in here. If you have evening primrose, throw it in here. All those supplements will not help you. If you have CQ10, yes, you heard me right. Throw it in here. What is CQ10? It's mostly antioxidants. The food you eat every day is high in antioxidants, most of the food. What else is high in antioxidants? Avocado. Throw that CQ10 here. I don't care what medication you have. Throw it in here. If you have collagen, yes, you heard me. Throw it in here. Once you get pregnant, your body, no matter your age, your body will naturally start reproducing collagen again. That is why they will say, oh, you have the pregnancy glow. Okay? Throw it in here. If you have vitamin A supplements, I beg you with the name of God, throw it in here. Excessive consumption of vitamin A or the consumption of high vitamin A diets or supplements will make your baby deformed or blind, or both blind and deformed. You are not allowed. So if you're using tretinoin, retinol, retin A, and you want to try for a baby, or you're already pregnant, tie it up. If not, you stand high chances of giving birth to a blind baby or deformed baby or both. Show them here. There's no point. I won't lie to you and I won't deceive you, okay? Because my reputation too is at stake. You don't need all those supplements in order to get pregnant. You don't. I have 5 children myself, okay? If you're new and you don't already know, boy, girl, boy, girl, boy, all born in the months of August and September. Why? Because I chose them like that. I've been teaching this for over 21 years now. And there are evidences everywhere. I've helped many people, free of charge, of course, because it's just a passion of mine. Why? Because I'm from the eastern part of Nigeria, where a male child is, in fact, is counted as the real child. If you don't have a male child, the place I come from is a very, very big deal. It's a big deal if you don't have a male child. So this is one of the things that propelled me into teaching this or into learning more, about this. And again, the truth is that what I'm teaching today is not just a day's thing, okay? It's something that I've studied over the years. It's more or less like a personal longitudinal study. I've studied it over the years, both on myself and with people that I've helped. So even if I'm being called up at any point by any researcher or any scientist, I can, even from my sleep, I can give them whatever answer they need, even without flinching. That is how much this is in me. It's more or less like second nature. And I believe that if you too pay attention and learn it properly, learn, you won't just help only yourself. You will help your families, you will help your friends, you will help your enemies so that they will be at peace with you. And most importantly, you will be able to pass the information down to the generations to come so that they won't be faced with any difficulty. Please, I understand that all those supplements, you spent a lot of money buying them. Again, I didn't say throw them away. Get a bag like this, put them, tie them up while you are trying this method. It's very important you tie them up. All the supplements, when I say all, you are not allowed to leave one behind. If you leave one behind, you will face the consequences yourself. Apart from the supplements, the other things you would need to tie up is painkillers. And what do I mean by painkillers? If you have paracetamol, tie it here. If you have Panadol, tie it here. If you have Tylenol, tie it here. If you have Tacaprina, tie it here. If you have Doliprane, tie it here. If you have ibuprofen, tie it here. If you have diclofenac, tie it here. If you have mefenamic acid, tie it here. If you have tranexamic acid, tie it here. If you have Solpadeine, tie it here. If you have Solpadol, tie it here. If you have Tramadol, tie it here. If you have Lemsip, tie it here. If you have Felvin, tie it here. If you have Temazepam, tie it here. If you have, I don't care what that painkiller is, but the truth is you can never get pregnant easily taking pain medication or painkillers or strong medication. It won't work. Most of the times, those medications work as contraceptives, but people don't even know. However, that is not a good way of doing family planning because you could be destroying your kidneys and your liver in the process. Okay? Now that I hope you have listened to me and you have accepted to tie them up. Now, we are ready to get pregnant and we'll move with it. Okay? I will wipe the board and we'll go to the next slide. There you will see how we are going to incorporate all the information here in order to get baby. Guys, don't forget, if you're trying for baby boy, baby girl, this is SS chromosome. Do not take avocado. Okay? However, you can take avocado before your period, the month you want to get pregnant with baby girl. As soon as you start seeing your period, you stop. And then you can take it after testing positive to pregnancy. However, I'm not teaching about baby girl for now. We are focusing on people trying to get pregnant and people trying specifically for baby boy. I hope that is clear. Okay? And then wipe the board. We move to the second slide, which I will ask everyone to get their books out. Get your books out and get your pens. You need 2 pens. One have to be red and the other one can be black or blue. Okay? The other one black or blue. June, July, August, September. Okay. Guys, for the dates, I think it's okay for us to start with June calendar. But as many calendar you have, the better. Get your books out and start writing. No matter how long you've been doing this, no matter how much you know this, I would like you to participate in the exercise. Get your books and write, okay? If you want me to use your date as example, you will have to come over to YouTube because I'm only going to focus on YouTube for now, okay? It's important that you are writing this so that you learn it in real time. Please get your books out and your pen. It's easier, I think, for you to learn it in real time. Guys, June is 30 days for those of us writing, okay? And July is 31 days. Make sure you are writing. There's no point telling me, oh, can you calculate for me? No, I will by myself only decide to calculate if I think you have a complicated issue or you have problem with reasoning. But whether you have problem reasoning or not with your reasoning, this is very easy, okay? Guys, July is 31 days, okay? August is 31 days. And September is 30 days, okay? And I'll do October as well because we've gone very far in September. Guys, the reason for having so many calendars like this is that it's always good to have it so that you will see the pattern of your circle. You will see whether it's regular or irregular or terribly irregular. Okay? It will just help give you an idea of what you should be expecting or what you should do with the numbers. Now, before now, I've seen so many TikTok native nurses, okay? They will tell you blah, 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 minus 14. No matter how many days cycle you have, minus 14. But no. If you people can agree with me, most of them have stopped now. Why? Because they've come to learn it. And most of them have realized that they are making mistake. And most of my students here on TikTok have gone to their page and corrected them. There's no such thing as minus 14. Everybody can be minus 14. You will find out in a minute. Why everybody cannot be minus 14? You can't. That's actually nonsense. Everybody possibly can be minus 14. Okay? And besides, we don't do minus in this page. Okay? We are not native doctors or native nurses. Now, let me see. Who is that person that I'm using her dates? So I will be using Big Amaka. I see Big Amaka. And she's June 11th, July 7th, August 2nd, August 26th. Guys, get your dates out. I need a perfectly working pen for this. Yeah, found one eventually. Now, this lady that I will be using her dates, the first time she saw her period was in June 11. Guys, circle that day you saw your period. Now, it doesn't matter if your period lasted for 3 days, 4 days, 5 days, 10 days. All what you're concerned with is the day one, even if it was just a dot of blood. That's your day one. So for this lady, Big Amaka, the first day of her period in June was 11th. Circle it like that. It doesn't matter how many days. We don't care about how many days period. Just circle it like that. And then the next time she saw her period was July the 7th. Guys, circle it like that. Then the next time she saw her period was 2nd of August. Guys, circle it like that. Again, the next time she saw her period was 26th of August. Guys, it's okay. Circle it like that. 26th of August. It's not a problem. It doesn't matter if your period came twice within a month. That's completely fine. Okay? That's completely fine. Now, look up properly. We want to use this date, okay, to calculate for ovulation. But before we do that, we need to ascertain how many days cycle does this lady have. Now, in order to identify, to know how many days cycle Big Amaka has, we will have to count from day one. This is how to count. This is day one. Guys, you see this day, the second time she saw her period in another month is the day last. Day one, day last. Day one, day last. The next one again, day one, day last. Day one, day last. The next one again, day one, day last. Day one, day last. I don't know if you got that. The time you saw this is your first day, day one. And then when will you count up to? You will count up to the first day of the next period will be the day last of this one. Day one, day last. 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 Okay? Day one, day last. Now let's start counting so that you will understand. Day one, day two, day three, day four, day 5, day 6, day 7, day 8, day 9, day 10, day 11, day 12, day 13, day 14, day 15, day 16, day 17, day 18, day 19, day 20, day 21, day 22, day 23, day 24, day 25, day 26, day 27. This day last is 27. Meaning is 27 days cycle from day 1 to day last is 27 days. You put a comma and then you go again for the next one. So day 1, day last is 27. Now we are going day 1, day last. Day 1, day last. Day 1, day 2, day 3, day 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27. 27. You write the 27 there, you put a comma. Now we have done day 1, day last, 27. Day 1, day last, 27. Now we are going day 1, day last. Day 1, day last. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25. 25. You write the 25 there. Guys, without being told, I know that this big Amaka must be my student. If there's something you noticed, her numbers have gradually come down, indicating that she actually has a small circle, but not dangerously small. She has a small circle. Now, guys, take a look at the numbers you have here. Again, don't be perturbed if you saw your period twice within a month. That's completely fine. After all, she saw her period twice in August. That's completely fine. You can see your period twice within a month. That's completely fine. Don't be disturbed that you're not. For some people, they will be like, oh, I used to see my period every 7th. Now I'm seeing it different dates. That is not how to count. You don't have any business with the days you are seeing it. Or the business you have is counting them. The circle. How many days circle a day? That's the most important thing. Now, there is something I have to let you know. There are some things that can affect these numbers you see here. What are they? If you were sick in a month, and because of the sickness, you took malaria medicine, or you took antibiotics, or you took a lot of painkillers, this number, your next period, your next cycle will be longer. If you were sick, even fever, catarrh, whatever, even without taking medication, your next cycle will be longer. Again, if maybe in the month of June, you were engaged in taking all sorts of concoction, terrible things, by the time you will be on your next cycle, this next cycle will be delayed. Can I let you know that whatever concoction you are taking, you've taken concoction here, you have tried for pregnancy here, I'm sorry to disappoint you, you will never, ever get pregnant that month taking concoction. It cannot work. Go and write it down. I'm wasting your time. Now, if these your numbers, okay, that there is no much spiking up and down and up and down, no much changes, drastic changes, like maybe going from 27, the next thing you jump to 30 or 35. If you're having all those kind of numbers, check yourself. You are either abusing painkillers or taking all sort of concoction or always treating one malaria or one typhoid fever or the other. It just means that you are very, very busy taking medication, which to get pregnant will nearly be impossible for you. Nearly impossible. So, in order to get pregnant, watch yourself. Now, I understand that some people, theirs might be, they can't control it. Why? Maybe because they have PCOS. But again, you can control what you put in your mouth. Because whatever you are putting in your mouth, even as a PCOS patient, you can exacerbate your problem. Okay? You can be exacerbating your problem, taking concoctions like clove. I've seen somebody that took cloves and her cycle went from 27 to 75 to 76 to 40 something to 50 something. Mind what you are throwing in your mouth. Now, let's continue. So, if your numbers, if they're just maybe a day or two difference, then there's no cause for alarm. But a day or two difference does not mean that maybe you're not taking medicine, but just watch what you are taking. You are not allowed. Like I told you earlier on, if you don't already have that bag, you don't love yourself. You're not even ready to get pregnant. Now, everyone, now that we already identified the day of our period and we have successfully calculated our cycle, day 1, day last, 27, day 1, day last, 27, day 1, day last, 25. The next thing is, what do we do? Now we know these numbers. Guys, you look at those numbers strategically, carefully, okay? Carefully. Some of you might have 4 numbers. That's completely fine. But in her case, she has 3 numbers. Look at those numbers well. Choose the smallest number. Now, in this lady's number, the smallest number is 25. Take the smallest number and divide it by 2. Her smallest number is 25. 25 divided by 2 is 12.5. Take that 12.5 very quickly and count 12.5 from that last day of period. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. 12.5 will be somewhere here. And then, because we are not doing mathematics, so we are not rounding up or rounding down, we will just circle the 2 days together. Okay? And drop that pen. As soon as you circle that day, quickly, this day that you have just circled becomes automatically your estimated ovulation day. Take note of the word estimates. It becomes your estimated ovulation day. Not your ovulation day, but estimated ovulation day. Why? The only thing that can tell us your real ovulation day is ovulation tester. Okay? Now that you have circled your estimated ovulation day, grab a black or a blue pen quickly and circle the 3 days prior or before this estimated ovulation day. Circle the 3 days. Now, these 3 days you have just circled are the days you will start testing with your clear blue ovulation tester. Now, I must say, if you have successfully identified the day of your periods, and then you succeeded in counting or knowing how many days cycle you have, you progressed, okay, to identifying the smallest cycle and dividing it by 2, arriving at your answer and counting your answer up until the estimated ovulation, and you then went ahead to circle the 3 days before it. I must congratulate you. You have officially passed the first step, which is one of the most crucial steps. At least I'm aware that before I came to TikTok, that all those native nurses were charging 150,000 to calculate ovulation for people. But guys, guess what? They have been calculating garbage. They have been calculating rubbish for people. Why? Because they don't even know what they are doing. They keep minusing -14. Guys, did you hear any -14 here? Did you hear any minus? And besides, what we use here is 12.5. That is because she has a circle. One of her circle is 25, and half of 25 is 12.5. Look at another of her circle is 27. Half of 27 is 13.5. So where the hell are those native nurses finding -14 from? I don't have a clue. Guys, if you find anybody saying -14, continue to correct them until they come to their senses, because they are passing information that have potential to keep a woman that is not barren. Because if you're not trying for pregnancy around or at the peak of your ovulation, how on earth are you going to get pregnant? Now, I must congratulate you. If you have gotten to this stage, this is the first step. They were charging 150,000. They reduced it to 70,000. No customer. They reduced it to 50,000. No customer. Now they've reduced it to 0. I don't know how they are getting customers now. I don't know. Maybe they are doing 419 now. I have no clue. But it is what it is. Guys, this is going to be permanently on YouTube. It's already there on my YouTube live. Okay, for your own consumption. Or if you know anybody that doesn't know how to calculate, you don't need to waste money that you already do not have. Give it to teach people free of charge. You don't have to make money off everything or off every person you come across. This is easy. Okay? And that's it. Now we have these numbers. Now, what are we going to do with these numbers? What next? That's the big question. Well, it's a big question, but it's a small issue. Everybody, let's stay quietly and listen attentively at this point. From the first day, you start seeing your period, the process of conception begins. From day 1 of your period, just bear in mind that any day you just suddenly start seeing your period, that day, the process of your pregnancy, the process of you getting pregnant begins. That is why when you test positive for pregnancy, they start counting from your last period. What does that mean? According to Edith's natural method of gender selection, whatever you do, whatever you put in your mouth will be used against you. Whatever you do from that day will determine how far you will go with your pregnancy. It will determine whether you will get pregnant or not. So it's very, very important that you pay particular attention to yourself from the first day you start seeing your period. Now, from day 1 of your period, this day, I'm talking to everyone. You are not, never, in any circumstance, allowed paracetamol. You are not allowed to take paracetamol, no Panadol, no ibuprofen, no Felvin, no diclofenac, no mefenamic acid, no tranexamic acid, no Sopadine, no Sopadol, no Tylenol, no Doliprane, no Tacaprina. Guys, no Lemsip, no Actifed, no... What is this one that they are taking in UK? No Tramadol, no Cocodamol, no Temazepam. You are not allowed to take any form of medicine. You are not allowed antibiotics. If you take malaria medicine, null and void, try again in 3 months' time. If you are sick and you take any medicine, I'm sorry, go and get well. You are sick with typhoid fever, you are not allowed to get pregnant Try again, get well, and get pregnant in 3 months' time. Any medicine you take, that is the end. You are not allowed. The only medication you can take is folic acid. End of story. Now, exception goes to those people that are on long-term management for diabetes. You are allowed to take your diabetes medication. Exception goes to those people that are on long-term management of high blood pressure. You are allowed to take your blood pressure tablets. Other than that, you are not allowed any, when I mean any, not even the tiniest dose of any medication, except folic acid and, of course, iron medication if indicated by your doctor. Number 2, you are not allowed from day 1 you start seeing your period. You are not allowed no clove water, no zobo drink because there is clove in it. You are not allowed no lemon, no lime. They use it for abortion. If you take it, you go abort your baby. If you get pregnant by accident, you will still lose it eventually. So don't even bother. You are not allowed lime, lemon, clove, zobo drink. You are not allowed. You are not allowed ginger shots. If you take it, it will shut out your baby. If you take it, you will regret it. You are not allowed. You are not allowed prekese. You are not allowed uziza seed. You are not allowed uda. You are not allowed ajun bise. You are not allowed. From the day you start seeing your period, the same month you want to get pregnant, you are not allowed pepper soup. You are not allowed white soup. You are not allowed anything that has pepper soup spices in it. Okay? You are not allowed. Again, right now, we are dealing with a case of you are not allowed black soup. Guys, you are not allowed to take any soup that has the potential of washing your womb. Why? It will not only wash your womb, but it will wash everything and anything inside, including your baby. Because when you are about to get pregnant or when you have just tested positive to pregnancy, your body won't really recognize it as a real baby yet because there is no bone, no skin, no nothing. It's just a block of blood molded in the shape of a toad or a baby. So whatever you take will not only wash out other things in your womb, it will wash out the baby. So you are not allowed. From the day you start seeing your period, the same month you want to get pregnant, you are not allowed weight loss tablets. You are not allowed weight loss teas. You are not allowed Chinese teas. You are not allowed green teas. You are not allowed English Earl Grey tea. You are not allowed any herbal tea. You are not allowed. Please. You are not allowed. Stay away. From the day you start seeing your period, the same month you want to get pregnant, guys, please and please, you are not allowed. You are not allowed concoction. From who? From native doctors, from native nurses, from your mother-in-law, from your father-in-law, from your own mother, from enemies, from friends. You are not allowed any concoction. You are not allowed Vietnamese concoction. Believe it or not, somebody was paying 600 euro per month for Vietnamese concoction. How ridiculous. For years. And no baby still. You are not allowed. No concoction from Vietnam. Let them drink whoever is making it should drink it. Don't take it. You won't get pregnant. You won't. You are not allowed any form of concoction. From the day you start seeing your period, the same month you want to get pregnant, you are not allowed coffee. You are not allowed cappuccino. You are not allowed latte. You are not allowed anything that has caffeine. You are not allowed Milo, Bonvita, hot chocolate, chocolate drink, ice cream, especially if you have been trying for many years or you are trying particularly for baby boy. You are not allowed yogurt. You are not allowed milkshake or milks. You are not allowed. Okay? Except you don't want baby boy. You are not allowed. From the day one you start seeing your period, the same month you want to get pregnant, you are not allowed to take people that like chocolate because that chocolate contains milk. and it contains chocolate. You are not allowed. You are not allowed sugary stuff, except you don't want baby boy, except you don't want to get pregnant. Guys, no Coke, no Fanta, no mineral, no Sprite, no 7-Up, no apple juice, no orange juice, no beetroot juice, no juices. You are not allowed. You can't take it, and you won't take it. If you take it, you bear the consequences yourself. You are not allowed. Now, if you are trying specifically for baby boy, or you have been trying for many years, from the day you start seeing your period, the same month you want to get pregnant, you are not allowed pork meat, sausages, bacon, sausage roll, shawarmas, hot dog, pork chop, scotch egg, because the skin is made with pork meat. You are not allowed pork meat, or anything that has pork meat is extremely acidic. You are not allowed. Okay? Now, from the day you start seeing your period, the same month you want to get pregnant, if you have been trying for many years, or you are trying specifically for baby boy, you are not allowed any form of fried food. You are okay to air fry your food. If you don't want to air fry, boil all your food. Avoid fried foods, except you don't want baby boy, except you don't want to get pregnant. Avoid fried foods, please. Most importantly, from the day you start seeing your period, the same month you are trying for pregnancy, if you have been trying for many years, or you are trying for baby boy, or this one, even baby girl, or you are trying for any baby at all in your life, you are not allowed nuts. No groundnut, no peanuts, no Brazil nuts, no walnuts, no pistachios, no cashew nuts, no groundnuts, no peanut soup, no groundnut soup. I'm begging you with the name of God. You are not allowed. The only nuts you can have, if you want to have nuts, is almond nuts. Okay? Any other kind of nuts, you are not allowed. Please. Nut allergy is extremely dangerous. Guys, pay particular attention about this nut, especially if you've had history of unknown reason for miscarriage, history of unknown reason for having a stillbirth. Avoid nuts with everything you have in your life. Avoid nuts. Avoid nuts. Because you can never determine which of your baby will be allergic to nuts. Avoid nuts. Now, I think for now, that might be it. If I remember any other thing, I will let you know. Now that we are done with all the don'ts, what are the do's? From the day you start seeing your period, the same month you want to get pregnant, you take your avocado. Guys, if you have history of PCOS, hormonal imbalance, cysts, ovarian problem, fibroids, as you are watching me right now, be taking avocado. Even though it's not yet time for you to get pregnant, just be taking avocado to help repair, replenish, okay, and get you ready for baby. Okay? That's why on this page, you will get pregnant despite your diagnosis. If you are doing everything right, despite your diagnosis, you will still get pregnant, and you shut the dirty mouth of your mockers. Those people mocking you, their mouth is about to be shut with your testimony. Just be patient and make sure you are doing the right thing. Okay? Now, you start eating your avocado. Before now, 3 months before now, you start taking your folic acid. If you are not already taking folic acid, make sure that today doesn't pass you by. It's very important you are taking folic acid in order for you not to give birth to baby with a lot of birth defects or any abnormality. Please, okay? You take your folic acid, you take your avocado, you are drinking water, you are minding your own business, okay? You're not taking any minerals, you're not taking any concoction or any rubbish and nonsense. You eat your normal food, not fried food. Avoid everything I told you to avoid. Eat your normal food, but make sure you're not eating greasy food. What do I mean by greasy food? Food that have a lot of butter, food that is fried, too much oil, avoid. Okay? You eat your avocado, you take your folic acid, drink water, mind your business. Every day, avocado, 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 avocado. And once you get to these 3 days before your estimated ovulation, double your avocado intake. And if you can, triple it as tolerated. You start tripling your avocado from then on, and then bring out your clear blue ovulation tester. The particular one that I recommended that I put on my page. The purple one, not the pink one. Okay? It's important you buy the one that is purple. Go on my TikTok page and you will see it. If you know you don't want to make mistake, that you don't want to go and end up buying the wrong ovulation tester, you can run to my TikTok page. Underneath my profile picture, you will see link tree. Click on the link tree, you will see Amazon. Click on Amazon and get yourself your ovulation tester. And the one you are getting the 36 because that is more economical. Just in case you don't get pregnant the first month, most definitely you will have more than enough to try in the second month. And while you are there, make sure you get your pregnancy tester because, oh yes, you will be testing for pregnancy exactly 2 weeks after your estimated ovulation. And then plus or minus maybe 5 days for those of you that are impatient, that end up taking rubbish and nonsense when not knowing that you're already pregnant. Now, you bring out your ovulation tester from these 3 days before your estimated ovulation. You test with your ovulation tester in the morning. You're only using urine, early morning urine, or urine that has stayed minimum of 4 hours in your bladder. Urine that has stayed in your bladder minimum of 4 hours. Undiluted urine, okay? You take your sample, test in the morning, and if you see this empty circle, that's completely fine. There's no cause for alarm. Test again. If it's still empty, that's okay. Test again. If it's still empty, that's fine. Test at night again. If it's still empty, that's okay. Test the next day. And if it decides, you see this and it's flashing, pam, pam, on and off, that's completely fine. But that's not yet time for you to do anything. Keep testing. Don't meet your husband yet. Test again at night. And if this smiling emoji is still flashing on and off, it's still flashing, pam, 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 don't do anything just yet. Test again the next day. And if it's still flashing, that's completely fine. Test again. If it's still flashing on and off, test again. If it's still flashing on and off, test again. If it's still flashing, no problem. Test again. And if this baby decides to stand still, this smiley emoji decides not to flash anymore, it's just standing still, then you count 12 hours. When this smiley emoji is not moving again, it's just standing still, looking at you like this. Count 12 hours. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. 12 hours means that you are then at the very, very peak of your ovulation. Okay? 12 hours and more, but I'm telling you, count 12 hours, will qualify you to have multiple babies, but not guaranteed 100%. Okay? You can have twins, triplets, quadruplets, like we already have few people with triplets and one person with quadruplets. Okay? Now, it will qualify you for that. But once you have counted 12 hours, then you can then meet with your husband. What do I mean by meeting with your husband? Have sex with your husband. Once you have counted 12 hours, after this baby was standing still, you can have sex with your husband. It doesn't matter. You can have sex with him 1 million times that day. Okay? That day, 1 million times is the first sex that counts. After then, that's the end. Especially for those of you that are finding it difficult to get pregnant. Don't meet him again. After all, he has met you more than 1 million times that first day. Let him take a break, rest, in order not to interrupt the implantation process later on. Now, you will then count extra 48 hours. You will then, after meeting with your husband once or multiple times, is the first one that counts. Even if it's a tiny dot of sperm, it doesn't matter. Once after meeting your husband, count another 48 hours. Then after 48 hours, you can start eating all your fried foods again. After 48 hours, you can start drinking your juice again. You can start taking your minerals again, but don't take Coca-Cola until you have tested positive to pregnancy. Don't ask me why. Don't ask me. Just do what you are asked to do. Okay? Don't take Coca-Cola until you test positive to pregnancy. You can still eating all your pork meats, bacon, shawarma, egg roll. You can start eating everything. However, you can never, and you will never go back to taking Prekese. You can never go back to taking Uziza Uda seed. You can never go back to taking pepper soup spices or pepper soup. You can never go back to taking black soup or salad soup. You can never go back to taking peanut soup until you deliver. You can never go back to taking any medicine. The only medicine you can take is folic acid and iron medication if indicated by your doctor. Okay? You can never go back to taking any nuts. If you try it, only you and you alone will face the consequences. Guys, you can never go back to taking nuts. Even when you deliver your baby, you are not allowed to kiss your baby after eating nuts. You are not allowed to touch that baby except you have washed your hands carefully and thoroughly. Nut allergy is extremely fatal, very dangerous. It can kill within minutes, in some cases within seconds. And when it kills, it's irreversible death. No pastor can pray back that baby. It's better for you to do the right thing now, or you face the consequences later. And I understand that some of you like copying and doing things you are not supposed to do. When you start weaning your baby, don't go and make all those kind of baby food pap that you will blend cashew or peanut. If you try it, if your child is allergic to nuts, that child will die irreversible death. Guys, avoid nuts. Don't feed your baby nuts until your children any nuts until you have determined or established that child does not have nut allergy. Nut allergy is one of the most deadly form of allergy you can have. There are other many kinds of allergy. Some people are allergic to penicillin. Some people are allergic to milk. Yeah, equally deadly. Nut allergy can cause you major anaphylactic shock seizure that can lead to irreversible death. Please, let's be guided. Now, that is it for the woman. What about your husband? What will your husband do? For the men, ladies, listen, this is what your husband needs to do. From the day you start seeing your period, throughout that month you want to get pregnant, your husband is not allowed to meet you, that is, he's not allowed to have sex with you or have sex with his ugly side chick or masturbate or ejaculate in any shape, form, until this baby is standing still and you have counted 12 hours. Your husband is not allowed, from the day you start seeing your period, the same month you want to get pregnant. Guys, that is why it's very, very important that if you will be trying this Edith method of natural gender selection, that you have a very good discussion with your husband, so that both of you will be on the same page and be in agreement. Because the truth is that if your husband keeps ejaculating every day, everywhere where he's going, up and down, is another form of family planning. Even if he's meeting you every day, is another form of family planning, and you will never in this life get pregnant. A man that is having sex every day, his sperm will not be rich enough to fertilize egg. That is a form of family planning for men, but that's not what I'm going to discuss here today. Okay? So, that is to tell you that with Edith's method of natural gender selection, if you are a man with low sperm count, provided your sperm count is not 0, you will get pregnant. You will get your wife pregnant, sorry. You will get your wife pregnant. If your sperm is full, and you are knocking indiscriminately, whatever you see, your wife will not get pregnant though. So you better zip up that your ugly looking zip. And stay with your wife. Be patient with her. Especially from the day she starts seeing her period, the same month she wants to get pregnant. Stay faithful, loyal. Don't ejaculate. Don't knock yourself. Don't masturbate, okay? Don't go and get a woman side chick. Don't go and be misbehaving. Just stay with your wife. Stay faithful, okay? Till the peak of our ovulation, when this smiling emoji is standing still and you have counted 12 hours, you can then meet. That is actually the only thing the man is required to do. Men are not supposed to do anything. Of course, your husband can join and eat avocado, and then he can then eat avocado and banana for better sperm quality and stronger manpower during the bed activity or exercise, during the activity in the other room. That is all you have to know for now. Guys, I won't deceive you. I have my own full-time job. I have my children. I have very, very good reputation, at least as far as I know. And for me to put myself out here, I can never be caught talking rubbish or doing something rubbish, because I value my dignity and self-respect. I believe and I strongly know that if you follow everything that I've asked you to the very T, cross your T's, dot your I's, with the help of God, there's no way you will not get pregnant. After all, you have tried everything. You have tried everything. Why don't you be patient? Try this. And let's see. Congratulations in advance. And I look forward to hearing your testimony. My name is Edith Anyamene. Those of you on YouTube, you can join me on TikTok. My name is Edith Anyamene on TikTok. My name is Edith Anyamene on YouTube. Feel free to join me. I will be waiting for you. Thank you. Okay.